Please note that this session is being recorded. If you do not consent to being recorded, please do drop off the call at this time. Thank you. Okay, I don't see anyone else in the waiting room, so I think we can go ahead and get started. Good afternoon, everyone, and welcome. My name is Brett Weber, and I'm a Public Health Policy and Programs Manager with the National Indian Health Board. I will be moderating the fourth session of the Enhancing Tribal Environmental Health Programs Engagement in the COVID-19 Response webinar series. Today, Captain Stephen Piontkowski, Michael Goldschmidt, and AJ Salkoski joined us to cover the Healthy Homes resources to improve the health and safety of the home environment. Before we start, I just want to review some housekeeping notes. We've been doing Zoom for a while, so I think we should all be old hat at this, but it's always good to just make everything clear. As I mentioned, today's session is being recorded. If you don't consent to being recorded, please do drop off the call at this time. The presenter's PowerPoint slides and recording will be available for you to download next week. We will send an email out to the email address you registered for this webinar with. I've also enabled live transcript for the meeting today, and if you wish to hide that live transcript, just click on the live transcript button and then hit hide subtitle. All participants have been muted, and we ask that you please leave yourself on mute unless the presenter specifically asks you to unmute and engage. And that's just to reduce background noise that I think we've all experienced on the Zoom meetings over the years. However, if you do have trouble hearing during the presentation, please let an NIHB staff member know by sending a direct message to them via the chat box. That's myself or my colleague, Adriana Marzette. Feel free to message either or both of us. And we encourage you to enter questions into the chat box throughout the webinar. And once we get to the Q&A portion of the webinar, you'll be able to either type your question into the box or raise your hand and we can unmute you for you to ask your question. Again, if you're not speaking during the Q&A session, please do remain muted. And with that, I'm going to introduce our speakers for the day. Captain Stephen Piontkowski is a Senior Environmental Health Officer detailed to the Indian Health Service Division of Environmental Health Services. In this role, he provides program management support to division staff nationwide who serve 2.7 million American Indians and Alaska Natives in 574 federally recognized tribes in 30 states. He has been with the IHS Division of Environmental Health for over 22 years, is a registered environmental health specialist with the National Environmental Health Association, earned a BS in Environmental Hazardous Materials Management and Biology from the University of Findlay, and an MS in Environmental Health from East Tennessee State University. Mr. Michael Goldschmidt is an associate teaching professor in the Department of Architectural Studies at the University of Missouri and a state housing environmental design specialist at the University of Missouri Extension. Since 2014, Mr. Goldschmidt has led the USDA/HUD National Healthy Homes Partnership as the director. Michael is a licensed architect and interior designer. Mr. Goldschmidt coordinates, develops, and leads MU extension programs on energy efficiency, sustainable housing, indoor air quality, and healthy homes. Mr. Goldschmidt received his Bachelor of Architecture from Kansas State University and MS degrees in Architecture and Green Building from the San Francisco Institute of Architecture. And finally, AJ Salkoski is the Government Technical Representative of the Tribal Healthy Homes Program at HUD's Office of Lead Hazard Control and Healthy Homes. He has managed various environmental and environmental health projects throughout Alaska. He is now working with tribes and tribal entities throughout the United States and has also managed a large respiratory health study that contributed to the Greg Cook EPA Clean Air Excellence Award for Visionary Programs and earned the initial HUD Cross-Sector Collaboration Award between the housing and health sectors. He holds undergraduate degrees and a master's degree from the University of Indianapolis. And I've done a lot of talking, so I think we're ready to turn it over to our presenters. So Captain Piontkowski, go ahead.
Thanks, Brett, appreciate it. May we have the next slide, please? And could we share the results of our agency poll? One of the things we wanted to do in the beginning here is to learn a little bit more about you, now that you know a little bit more about us. And it looks like we have about 35% of you representing tribal organizations, 35% from federal, 15% from nonprofits, and the rest from state academics or other organizations. So I appreciate that. We can stop sharing this poll. Good day, everyone. My name is Stephen Piontkowski. I am a Senior Environmental Health Officer with the IHS Division of Environmental Health Services. And it's a pleasure to be with you all today alongside my colleagues, Michael and AJ. In the interest of continuing to learn a little bit more about who's in our audience today, we have 3 more poll questions. Could we launch the next poll, please? Do you consider yourself a housing professional, a tribal leader or decision maker, a medical or public health professional, or a family or community member? And we'll close this poll in about 5 seconds. Answers are still coming in, so we'll let it roll a little longer. Appreciate everyone participating. Okay, could we please end the poll and share the results? It looks like a majority of us, of you, are from a medical or public health profession, and we welcome those from families and communities, and of course, we welcome the tribal leaders and decision makers. Could we launch the next poll, please? How much experience do you have with Healthy Homes initiatives? None, a little, substantial, or you're considered an expert? How much experience do you have with Healthy Homes? And we'll close this poll in about 3 seconds. And please launch the results. So it looks like about 45% of you are a little bit familiar with Healthy Homes and 20% substantially familiar, and another third of the group is not familiar at all with Healthy Homes. Wonderful. This all helps us determine and hone the messages we're providing today. And I have one more poll question for you. Could we please launch the next poll? Are you aware of the 8 principles of a healthy home? Are you aware of the 8 principles of a healthy home? Okay, can we close in about 3 seconds? Okay, and can we share the results? Oh, you guys are way ahead of me. It looks like a majority of the audience is not familiar with Healthy Homes, and 25% somewhat familiar, and a small percentage familiar. So I appreciate all the public health and medical practitioners that are out there that are somewhat familiar with Healthy Homes and the 8 principles. And hopefully, as we go through this session, together today, we can learn quite a bit more about Healthy Homes. You know, June is National Healthy Homes Month. And in preparation for that, we thought it was a good time of year to remind people that there are tribal publications and resources available to address Healthy Homes issues. Next slide. So hopefully by the end of this session, we're able to share with you some of the Tribal Healthy Homes publications and a brand new Tribal Healthy Homes smartphone app that's available to you all, as well as some basic key concepts and principles of a healthy home. Next slide. We will do that by first me giving a little bit of an introduction on the basics of Healthy Homes, and then I'll turn it over to Michael, who will discuss the Tribal Healthy Homes publications and smartphone app and demonstrate how those resources can be used. AJ will then take us through some of the HUD grants that are available and some of the success stories from those grants before we close out our time together with a question and answer session. Next slide. Healthy homes, or sometimes referred to as healthy housing, is a recognition that the environment we live in can cause disease or injury. And it's also a recognition that there are opportunities to enhance the safety of our home environment at nearly every home site we encounter. A healthy homes approach is a comprehensive one that tries to reduce the risks of illness and injury found in the home by focusing on small behavior changes that we can make throughout our home site to give us a safer home as well as a healthier place to be, and thereby making ourselves healthier. One of the key concepts that is essential to that is the 8 principles of a healthy home. I'll take you through each one of those principles briefly, just to make sure we're all on the same page before I turn it over to Michael. The 8 principles of a healthy home are to keep it dry, clean, safe, ventilated, pest and contaminant free. We want to keep the home site well maintained and thermally controlled. So the first principle of a healthy home, keep it dry. We want to make sure that that water is outside of the home site, and we want to make sure that it stays outside and also drains away from the home site to prevent any moisture and the problems moisture can cause inside the building. The second principle, keep it clean, is to make sure that we're controlling the dust and contaminants that we frequently find within the home site. When feasible, it's great to have smooth, durable surfaces that enable effective cleaning. We also want to keep it safe, and this is a bit of an injury prevention message. We want to make sure that the home site is free of the hazards from slips, trips, and falls. We want to make sure that chemicals in the home are stored in durable, leak-proof, labeled containers. It's also where we frequently talk about the need for operable smoke alarms to be placed in the right locations throughout the home. The fourth principle of the healthy home is one that we've probably heard quite a bit about over the course of the past 2 years, and that's to keep our houses well ventilated. Ventilation is a very important step to making sure that not only places like bathrooms that produce moisture and kitchens that produce smoke receive fresh air to move some of those contaminants out of the home site, but it's also important to make sure that we're bringing that fresh air into the home. And there's frequently new publications supporting the need for good ventilation within buildings and within home sites. The fifth principle, keep it pest-free, addresses a little bit about addressing or using a integrated pest management approach to make sure that those rodents and critters and insects stay out of the home. The reason pests come into a home is because, number one, there's a place for them to get into the home or into the building. And number two, because there's something for them to eat. So it's really important that we seal all those gaps and openings to the outside, as well as make sure that all the food we have are in durable, leak-proof containers, and we're also keeping that home site clean. The sixth principle of a healthy home, keep it contaminant-free, sometimes refers to home sites that were built before 1978 that may have lead-based paint. And there are certain things that we can do to, number one, determine if that hazard exists in the home, and number two, how and what we can do to eliminate that risk from the home. It's also where we frequently talk about radon gas and the hazards from radon within buildings. Again, there are things we can do to, number one, determine if that is a hazard that we need to deal with, and then how we can deal with it. The seventh principle is to keep it maintained, and this is fairly basic. Let's take care of those small repairs in the home before they become large, costly repairs. And finally, let's keep our home site thermally controlled. Typically, it's recognized that if we have an indoor air temperature between 68 and 78 degrees Fahrenheit, you're at a safe, healthy temperature indoors. These are the very basics of healthy homes, and these were the principles used when we collaborated to produce the Tribal Healthy Homes publications led by Housing and Urban Development. The three of us were involved in that project that we're presenting to you today. And Michael's going to talk to us next a little bit about, number one, the details of those publications and resources, as well as a brand new smartphone app, Tribal Healthy Housing smartphone app. And I'm not sure if others can see the presentation, but I do not see the slides, just in case. And with that, I will transfer it over to Michael. Thanks.
We have the slides back. Dree, if you could change the display settings back to swap. There you go. Thank you very much. Welcome, everybody. Thank you, Stephen, for the introduction. And thank you for the opportunity to talk with you about this project. As Stephen talked about, I'm going to talk about 4 guides and 1 smartphone app that are available to you for your use and for the families that you work with. I want to first talk about what is the Healthy Homes Partnership, which is the organization that I represent. We are funded by the HUD Office of Lead Hazard Control and Healthy Homes, and with the USDA, National Institute of Food and Agriculture. We are extension and outreach educators at universities working on a common goal of teaching about healthy homes, and especially the 8 principles of a healthy home that Stephen referred to in his presentation. The program actually started at the University of Wisconsin, then was at Auburn University for a number of years. And since 2015, it's been here at the University of Missouri. And I'm the director of the Healthy Homes Partnership, as was talked about in the introduction. Next slide, please. So we do have a link that's going to go up also, and we have a poll question that's going to come up. If you could answer the poll question. And after you've answered the poll question, AJ has actually put up the link that goes to these guides that I'm going to be talking about. Let's give it a little bit more time. Okay. I think we have the results. It's good to know that some of you are familiar. For those of you that are not familiar, I'm glad to be talking with you today. And hopefully by the end of this presentation, you'll be very familiar with these guides. So let's talk about these guides. These guides are not the original version of an American Indian, Alaska Native version of the Healthy Homes Guide. There was a previous guide that was around for approximately 10 to 12 years that I'll show you the cover of in just a little bit. But one of the things that we were tasked to do is to produce an updated version of that guide. There was a single guide originally available out of Montana State University through the Healthy Homes Partnership. We were tasked to update them. And one of the first things that we realized was that some of the feedback we had on those that original guide was it was too long for use for families, and it didn't address specific needs of various parts of a community across the United States. So we're going to talk about these 4 guides. The guides vary between 28 and 40 pages each. And there are 4 guides. One's for housing professionals, one's for leaders and decision makers, one's for medical and health professionals. And I saw through the poll that many of you are coming from that community. And then, of course, the 4th one is available to families. If we could go to the next slide, please. So many of you may be familiar with this cover in this guide. This was the original version of the guides I'm talking about today. This one was called Help Yourself to a Healthy Home. And it had lots of information about the 8 principles and specific information, for instance, on contaminant free. We talk about radon and carbon monoxide. But again, some of the feedback we got from this guidance, and this guide actually predates a lot of social media like Facebook and Twitter and things like that. But one of the things was it was too long for families used. It was hard to use. It didn't have critical information that decision makers would need. So we decided to update the guide. So I'm going to talk now about each of the 4 individual guides. So if we could go forward to the next slide. So we started with the original guide. And of course, one of the challenges that many of you are aware of is that there are so many different federally recognized tribes, and to respond to the specific needs of an individual tribe is challenging. But there are some overlaps. Mold is mold, radon is radon. So how we eliminate that from a home is going to be similar regardless of the tribe, but there is some tribes that have specific information that we needed to address. So that was one of our priorities. We also wanted to adhere to best practices and usability. For instance, 20 years ago, it was not uncommon for bleach to be used to remove mold. That's no longer recommended. So we had to make sure that everything we recommend is something that was peer reviewed and that the federal agencies and other agencies that teach about healthy homes were promoting what is the best practices. But we also don't want to overwhelm the readers and the users of the guides. We don't want people to feel like it's not possible to have a healthy home. But by following these guides, you can improve the home's deficiencies so that we no longer have as many, if not all, of the healthy homes issues. Next slide, please. So these are the 4 guides again. I mentioned before that there's housing professionals, leaders and decision makers, medical and health professionals, and families. I'm going to start talking about the families guide. The families guide is written for a 10th grade reading level, which is standard for all federal guides, to make sure that families, regardless of their level of education, can actually understand the information. It's also the shortest of the guides. It's the 28 pages. It goes through some very basic fundamentals. And then we'll talk about in a minute the ideas that are common to each of these 4 guides, but that would be the one that you would want to use. And AJ, I believe on an earlier slide, it's still in the chat window, has given you the link to actually go and download these guides. So we can go to the next slide, please. So I want to talk about the leaders and decision makers. Sometimes the idea for making improvements in healthy homes comes from the tribal leadership. So we have a special guide that talks about these issues at a community and a tribal community level. And so this list on this slide talks about the types of people that would use this guide. If we could go to the next slide, please. The medical and health professionals, which again, many of you on your poll question mentioned that this is the community you come from. This is the one that actually not only addresses the housing deficiencies and talks about structural or other deficiencies in the home, but it talks about the relationship between the medical symptoms and the medical ideas that people have about how to make their home healthier, so that you as a medical professional, health professional, can have a dialogue with the people that you serve. In the tribal communities. For instance, they may say, well, we've got asthma, but we're not sure what's causing the asthma triggers in the home. This is the guide that would address that. We definitely do not have the expertise that many of you in the medical profession, but we do have the housing expertise. So as a dialogue between you and us, we talk about what in the home is deficient that would be possibly causing those medical symptoms that your community has. Next slide, please. One thing about the medical and health professionals is it does get into specific information about the typical medical symptoms that would be related to a specific healthy homes issue. For instance, we all know that lead paint and lead piping is hazardous to children, especially under the age of 6. So we talk about in the guides, where would that lead be found in the home? What precautions the people that you serve, the families that you serve, need to be aware of where that lead is in the home so they can avoid that or take mitigation steps. And so it gets into more detailed information that you as a medical and health professional will understand how we're addressing those on the housing side. Next slide, please. We also know that there are housing professionals in the various tribal communities. Those people who do house repairs, home repairs, build new housing, look at basically housing directors and managers, code inspectors. And so we have a special guide for them to look at what are the issues that they would be concerned about or they would have jurisdiction over, and the idea of trying to improve the health of people in these various homes. Next slide, please. So one of the things that's common to all 4 guides is, and you'll see it's the same picture that Stephen showed earlier, that actual graphic is in each of the 4 of the guides. It's our 8 principles of a healthy home, where it talks about the 8 principles that Stephen talked about, and then gives a little bit of a background about what is the concern in each of these 8 principles. Next slide, please. The really great thing about these guides, and when we talk about the smartphone app, we'll talk about that also. But one of the great things about all 4 of these guides is there's 2 critical bits of information. One is on the right, a maintenance schedule. This is something that actually was asked for us by members of various communities, that they know they have to check their smoke detector. They know they have to check their outlets, but how often are they supposed to do that? And if they want to keep a healthy home, for instance, how often should they vacuum the floors, especially on carpeted floors, which would be an asthma trigger. So we, in each of these guides, have a really wonderful maintenance schedule that your families you serve can use to look at to make sure that they're on schedule for that. And then on the left is one page from each of the guides that has a room by room checklist. This has also been a very important part of this project, which is to allow families to do a self-healthy homes evaluation. You know, they can bring in an expert, they can bring in an extension person to help them with that, but oftentimes because of their location or their availability, they just don't have the time to do that. So what they'd rather do is be able to walk through the home on their own and look for signs of an unhealthy home in various aspects. So we actually really enjoy this self checklist, so that a person from a family can say, okay, we've got these boxes checked, and then take them to their health professional, to the medical community, and say, here's what we saw when we were in the house. What would you suggest we now do on the medical side to respond to that? Or to talk to one of the housing professionals to say, what do we need to change? What do we need to renovate, to repair in this home so we don't have this problem anymore? Next slide, please. What's nice about the guides, you can print them, but we find that a lot of people have the ability to read a PDF. And what's nice about a PDF is the hot links. So a person can go through these guides, regardless of which of the 4 they're using, click on, for instance, the link to lead, and it'll go automatically to a website or a guide that gives specific information, not only about lead and its hazard, but how to mitigate or remove lead from the home. And if that's not possible because of cost or other restrictions, how to avoid exposing children in the home to lead. So there's lots of hot links to websites, to other guides, on phone numbers. For instance, the poison control number, if you click on it, will automatically dial the poison control hotline. So there are some instances where it will automatically dial. Next slide, please. So what we're going to talk about now is the 4 guides as they were integrated into a smartphone app. I'm not going to spend too much time on this page, but just be aware that in Oklahoma State University, which is our app consultant, they provide many of the smartphone apps through the Healthy Homes Partnership, including the one I'm going to talk about now. If we can go to the next slide. If we could go to the next slide. Thank you. So I believe, AJ, you have a link. Fantastic. So AJ has just uploaded to the chat the link that goes directly to this app. Right now, it's available for Apple phones through the Apple Store. We are currently working on the Android, the Google Play Store version of it. We should have it out during the summer. So for those of you that have that phone, just be patient. We should have it out very soon. Also, there's a poll question that just came up, whether you're familiar with this. I see that many of you are not familiar with this app. So hopefully what you'll be able to do is to take the link that AJ has provided for you in the chat window. And if you're on your phone later on today, you can download that app. So one of the things about the app that is important is that we combined the idea of the 4 guides into a single smartphone app. So the first screen that you see on the left ask you to identify, are you a family member? Are you from the medical community? Do you have specific connection through youth, which is similar to some of our other apps? The second screen shows how you directly navigate the app, very app friendly, very user friendly. You can go directly to the chapters like you would in the guide. There are bookmarks. So if you say, I just want to come back to the mold chapter immediately, you can do that. There are additional resources, and the room by room checklist is available through there. And of course, the maintenance calendar. Very quickly on the checklist, what's great about the checklist on the app is when you go through room by room and you check boxes, you can actually generate a list of the boxes you checked and then email that directly to either your healthcare provider or to the tribal leader or to someone that's a housing professional doing repairs to make it much easier. The third screen is the room by room checklist, and the example on the far right is the maintenance calendar. Next slide, please. So included in the app is the room by room checklist. There is also a part that describes the 8 principles of a healthy home that Stephen talked about in the beginning. It does talk about the health impacts of some of the housing deficiencies. So for instance, if the family does find mold, then they can look at how to remove that mold to resources. Again, hot links to the resources, and then something that's very popular actually with the, I would say the youth up until high school is that we have a quiz. And the quiz goes through some basic principles. It can be used as a homework assignment for school. If you're training people in your agencies on healthy homes, it's a good thing to have them go through the quiz to make sure they retain the information. So it's a good way to bring that information instead of an actual written guide online, that you can actually have it on your smartphone, which we know that a lot of people now are relying on their smartphones for that type of information. Next slide, please. A couple last things about it. Very easy to scroll through, to bookmark, automatic phone dialing. You can see here is one of the screens where you can say, are you renting a home? So let's go directly to that, because the landlords are going to have information that is different than what you would need to do as a renter. You can see the 10 tips for a healthy home, to be quickly going to that. Special concerns. There are some special concerns that many of the tribes that we work with in developing this app and the guides said we need to make sure that this is included in there. For instance, making sure that there is safe use of wood burning appliances for wood smoke and for wildfires and things like that that do have an occurrence in many of the tribes that we talk to. Next slide, please. And this is, again, I believe the final slide. It talks about, again, direct information that you can go to for any of the hazards that a family finds in there. Again, key hotlines. So instead of finding where is the poison control number, you can click on key hotlines. It's going to go directly to all the phone numbers. So we've tried in the app to provide different methods of finding quickly the information that you would need. Next slide, please. If you have any information or questions about the app or the guides, this is the way to directly contact the person at the HUD Office of Lead Hazard Control and Healthy Homes, Kit Rodkey, who was involved in the app, but also can answer various questions about the development and future development of the app and the guides. You can also see that there are 3 websites at the top here. The HUD.gov Healthy Homes is the standard federal guide through HUD on healthy homes. The other 2 above that are websites that we at the Healthy Homes Partnership maintain with information. So at this point, I believe on the next slide, we're going to turn it over to AJ, who will then talk about grants available and grant funding for healthy homes.
Yeah, thanks, Michael. Can we go ahead and do the poll question? So I just wanted to see how many people were aware of these tribal healthy home grant funds that have been available starting back in 2018. I'm seeing a lot of no's. Okay. So just another few seconds here to let people vote. Not surprising that a lot of our public health professionals do not know about these HUD housing grants, but thank you all. That's why I'm here. So my name is AJ Salkoski. I work at HUD's Office of Lead Hazard Control and Healthy Homes. Prior to that, I worked at the Alaska Native Tribal Health Consortium, managing the healthy homes and air quality programs. And like they said, I was primarily looking at indoor air quality and how that was affecting respiratory health with Alaska tribes. So I have kind of a unique background where I've worked a lot with tribal housing. I worked in the tribal health system, and now I'm working at HUD, where hopefully I can help sort of build these coalitions between the two. So going back to 2018, our office began providing grants to tribes or tribal housing or tribal entities to address healthy homes hazards yearly. So up to this point, you can see the states that are colored in blue there. We have about 31 grants for about $25 million that are out right now in 14 states. So it's being utilized across the country, which is great. We love being able to help people, in as many places as possible. So that's really great. Next slide, please. So the big question is, what can we do with these grants, right? So the first thing we always go back to is the 8 principles of a healthy home. And I know you guys have been hammered with this over and over and over again, but they say, I think when I started doing this, it was 3 times 3 ways, and now it's like 8 times 8 ways. So now you're hearing it from 3 different people. So we'll consider that 3 different ways, but then when you read it and you start looking at the app and everything else, you're going to get your 8 ways in there. So really what we're looking at is removing these these hazards to the health of the residents in homes. Some of the common uses for these funds is remediating mold and moisture in housing, replacing heating devices that might be producing contaminants in the home, improving ventilation, like we've talked about. There's a number of reasons why that's good. It's not the magic bullet, but it does definitely improve air quality in the home if you are getting either that stale air out of the house or getting fresh air in. And then looking at safety and accessibility. So making sure that we can access the home safely, make sure the electrical systems are working correctly, making sure there's not trip hazards, making sure that there's not deteriorating parts of the home that are gonna potentially cause accidents in the future. So let's go next slide, please. So I just have a few before and after photos that I want to show you guys of things that have been done so far. This is from Southeast Alaska. You can see that there was some accessibility issues in trying to access the home at all. So building that ramp there, I believe an elder was living in this home. So, making sure that our elders and our children and other vulnerable populations have access to the home safely. This home actually also, you can see where they've been doing some remediation on the outside of the house. It is a rainforest, and there was some moisture damage there that they were remediating. Next slide, please. So on the left here, you can see an older wood stove that was in a home that was replaced with a low emissions EPA certified wood stove. Produces fewer particles, not only when you open the door and into the house because it's burning more efficiently, but it's also producing better air quality out through the stack, which your neighbors will appreciate. So we don't have air quality problems outside the home too. But it also is a safety issue, because when you have some of these older wood stoves that aren't burning as hot, you can get some of that creosote built up in the stack, and then you have the potential for chimney fires as well. So there are some dangers with those older wood stoves. And then on the right, you can see where above the one cooking stove, there's not a range exhaust. And what the range exhaust can do, whether they're vented out or vented through a filter back into the house, is remove a lot of that moisture from cooking, whether it's soups or boiling water for coffee or whatever else we might be cooking there on the stove. Because we don't want to produce all that extra moisture into the house that's then going to land on a cold surface and potentially lead to mold growth in the future. So just a few things that have happened so far, but we're looking forward to some more success stories in the future. Next slide, please. So on behalf of all of us, I want to thank you guys for the opportunity, for letting us come and present today, NIHB, as well as all the participants. It's really great to be able to get this information out there, especially to healthcare providers and healthcare workers, because you all a lot of times are the ones who see the results of the Healthy Homes hazards. And it's good for you to be able to relate those back to what's going on in the home and could be contributing to illnesses as well as injuries. So you can see here, we have our email addresses listed on the slide. Feel free to contact us. We're happy to talk to you, happy to talk about this, happy to talk about how we can work together in the future. And I guess I'll turn it back over to Brett so we can take some questions.
Sure, thank you so much, AJ. So we are in the question and answer portion of the webinar. Go ahead and either type out your question in the chat box, or what you can do is use the raise your hand feature and we can unmute you. We do have a question in the chat box already from someone, and I think this question might be for AJ. HUD included the tribal epidemiology centers in their 2018 notices, which was a good idea. We worked with tribal housing authorities and had lots of data we never monitored before. Are grants still including funding for public health jurisdictions?
The short answer is I don't know what funding is going to look like going forward. I haven't been told how the money appropriations are going to go, and we do not have a NOFO out publicly at this time. What I can say is that I do love that in prior versions of our grant that applicants were asked to reach out to the epidemiology centers from their region. And I think that going forward, the stronger relationship that we can build between the housing sector and the health sector, the more success stories we're going to see as far as reducing illness and reducing injury, as well as better quality of life going forward, because we're not seeing the results of these illnesses and injuries as people age.
Okay, thank you. And there is a question also for email addresses. So Michael's email is in there. AJ and Captain Piontkowski, could you please put your email addresses in the chat for folks to jot down? While other folks collect their thoughts and think about any questions, I do want to follow up on a topic that came up on last month's webinar in this series, the topic of mold. And could one of you or multiple of you talk about mold in the home and whether all mold is toxic, and whether that's something that tribal housing authorities should, how effectively they should monitor it?
Do you want me to take this first?
Sure. I will say that the last month's seminar was a good one, and I do recommend the folks on this call, if they haven't seen it, they should look at that archive. And it was a good session. And Michael, I'll let you answer the technical portion.
I was going to say for technical, there are a number of guides that HUD and other federal agencies have that are just literally step-by-step guides for what to do with mold. The direct answer to the question is not all molds are toxic. And one of the reasons there's no federal guidelines for mold. So there's federal guidelines for carbon monoxide, like at what point the alarm should go off, how much radon is hazardous to you. But one of the reasons there's no federal guidelines on mold is because it depends on where you're located. For instance, people in Florida have so much humidity and heat and mold that there is a tolerance that they have, say, for instance, compared with someone that may be in Montana, and it's also seasonal. So not all molds are hazardous, but the guidelines from the federal agencies, HUD, EPA, USDA, various federal agencies are, if you see visible mold, that there are safe ways to remove it. And the rule is, in general, if you're very healthy, so you're not elderly, you're not young, you're school age, you're a very healthy adult, and you're wearing proper personal protective equipment, PPE, then anything less than 10 square feet of mold on a wall or a surface can be removed safely by you. Again, you have to follow all of the recommendations. More than 10 square feet, they usually recommend a professional come in, at least advise you on that. That can be a person like me who's an extension specialist or someone at one of the agencies that you work with. To give you an idea of 10 square feet, if you did a snow angel on a wall, you waved your hands and feet, that's about 10 square feet. So if we're within that, and the recommendations now are not to use bleach. Bleach can be a lung irritant and actually make the situation worse. It's important to wear the PPE, and to use guidelines about ventilation, because sometimes the mold, when it becomes airborne, actually becomes more hazardous because people are breathing it in. That's the recommendations. There's a lot more that I could talk about, but that's the basics. That be concerned if you see it. If you're concerned that you think there's mold, but you aren't sure that it's there, you can't see it, then usually a professional at some capacity does have to come in to do that. But as far as testing for mold, the other recommendation that's changed in the last few years is that if you see the mold, to remove it. Don't wait for the testing to come back. Just go ahead and remove it, because every day you're waiting for a 2-week test to come back is one more day you're exposed to that. So that's the basic recommendations. And I could probably, while someone else is answering a question, probably post a link to the actual best mold guide from the federal government. I believe it's EPA and HUD and USDA generated it. So if there's no other question I have to answer, I'll go ahead and put a link up for that.
Perfect. Thank you so much for that deep dive into the mold issue, and I appreciate it. There is a comment in the chat that the snow angel is a good kind of visual for how to determine 10 square feet.
I like it too.
Yeah. And I don't see any other questions in the chat, so I'm going to go ahead and ask another question that I have. Can one of you talk about when a home should be tested for radon exposure and the particular dangers of radon gas?
I'm glad to start with that one. There are some maps of the United States to show which counties have higher than normal radon, but the rule is everyone should test their home for radon. It's actually not hard to get a test. Some states actually, and some programs, I'd have to check with AJ and Stephen, but some programs actually can give out free radon tests depending on what state you're in. So we actually recommend everybody get tested. And then you do get a test back, and it will give you, not to get too technical, but amount of radon in picocuries per liter. The federal guidelines right now, if it's above 4, there should be some type of mitigation in the home, although other places in the world have lowered it below 4. But in general, as far as recommendation, everyone should test. It's interesting because I've even seen places on the United States map where it's yellow, which means there's not a lot of radon, but seen pockets within that county where the radon can be actually pretty significant. So everyone should test.
I'll just add that this is Stephen. I'll just add that those test kits are even available at your hardware store, and
Yes.
pretty simple to use. Just follow the instructions and mail it in and get the results in a short time after that.
Yeah, and just one more quick thing on that. It really depends on your home. So if your home is up off the ground on pilings and there's air that's running underneath it, chances are you're not going to have it there. If your house is on a foundation and it's sealed, you're probably in good shape. But if you're on a foundation and there's even a small crack, or it can come in through your sump pump, and so your neighbors might tell you, hey, we tested, we don't have it here, and they might not, and you might. There's only one way to know, and that's to test. And you have to be really careful about those maps, because the maps can show that you don't have a lot of radon in your area, and a lot of times that's because of under testing. It's just showing that not that many positive tests have come back for that area, not that there isn't radon in that area.
That's a great point. And yeah, just to emphasize Mr. Goldschmidt's point earlier, everyone should test their home for radon. I do see Brandon has his hand raised, so I'm going to ask you to unmute and ask your question. You should be able to do that, Brandon.
Thank you so much, and thank you, everybody. This was a really great presentation. I'm located here in Minnesota, and there's a really big push for consultation. Our state in particular has a consultation law on the books. So I'm curious to, first of all, the methodology that you presented within your guides to Native Americans. meaning I'm trying to figure out like what's the distinction here? What makes this distinctly for Native Americans as opposed to like for just Americans? Because like lead paint, for example, affects everybody, right? I mean, that's one piece. And what's affecting people, let's say the Alaska Natives, is not necessarily going to be affecting the Dene people in Arizona. So, and granted, there are some health issues within this guide or health recommendations within this guide that would cover those pieces because it's broad enough, but still I'm not seeing the input from Native Americans when I look at this guide and in particular. Could you talk more to that piece? Like what makes this distinctly a guide for Native American people?
So Michael, maybe I can go first and then you can talk a little bit more about that
Sure.
process. Maybe we went through
Sure.
the process of how the materials were developed a little too quickly. So all of these are issues for healthy homes, regardless of whether they're on or off reservation or Native American or not. However, the way they're presented, and we did consult with Native American communities and partners that are involved with healthy homes issues on in Indian country, and maybe Michael, you can talk more about how that process went.
Yes, I'm glad to. Thank you, Stephen. So that's a very good question. I want to compliment you on your question because that is an issue that came up during the development, even on the original guide that we were not involved with, is why would there need to be a specific need for a guide related to tribal communities? And the answer is there is a lot of overlap. And like I mentioned before, mold is mold, radon is radon. But how the hierarchy works sometimes in tribal communities, Native American communities, is actually quite different. For instance, there is the Indian Health Service. There's a specific federal agency related to how this works on Indian communities and Alaska Natives. And so that was an issue that there are some resources that are specifically meant for Native Americans, American Indians, Alaska Natives. But there are also some subtle ways that we had to address certain information. So for instance, the tribal leadership in communities is different than say a suburban, I'm in Missouri, a suburban Missouri person would not necessarily use the same route for getting help as a person in a tribal community, because in suburban Missouri, there's no decision maker leadership that you would have on a tribal community. There are not necessarily specific contractors or repair people that would be involved. And so that's one issue. The second issue is it's a little bit subtle, but there were some, and I'll use one example of where, for instance, wood smoke is a very important part of every community, but there was especially in Alaska and some of the Northwest areas of the United States, there was a suggestion from these communities that we focus a lot on wood smoke in the homes and how that's dealt with. And especially in Alaska, some of the wood-fired heatings are not new, they're very old, and so therefore it was specifically requested that we address, for instance, wood smoke in a more sophisticated way, in a more detailed way, knowing that there would be many members that don't necessarily have, good working wood heaters. Some of them in Alaska were actually, 20, 30 years old. So there's other issues like that, but that's one example of where we had to address that issue more thoroughly, knowing that the community had more of an interest or more of a need for more technical information about that.
And just to kind of piggyback on that, there are some unique challenges that Native Americans and Alaska Natives face in terms of accessibility to healthcare, accessibility to building materials, accessibility even to how close the tribal housing authority might be to where they live. So that if they live in tribal housing, I mean, they could be a plane ride away to come and get something serviced. They might be a plane ride or 2 plane rides or sometimes 3 plane rides away from getting sophisticated healthcare services. So it's very, and then if you wanted a new wood stove in some places, you're going to pay 3 times what it costs because it's 1 time to buy it and 2 times more to get it there. So making sure that maintenance is a big part, because we know that things can't be replaced as easily or as inexpensively as being able to just drive down the street and get something. If somebody gets sick, which is really the whole point of this, is we're trying to prevent injuries, we're trying to prevent illnesses. If somebody gets sick, it takes a lot longer in a lot of cases to get that health care. So being on the preventive side of like, how do we really hammer home with tribal housing to do these things so they do it right and it lasts, and then also making sure that the residents are living in the house the way that it was intended to, with all these new systems that have now been built. We don't have a manual necessarily to say, here's how you live in a house. It's you move in and then you figure it out. And so making sure that people understand maintenance schedules, making sure that people understand how a ventilation system works in relation to maybe your dryer and your wood stove and these other things, and they're all running at the same time. And are you backdrafting? Are you not backdrafting? There's a lot of these intricacies that I personally have seen in rural and remote communities that are very different than what I saw growing up in Indiana. Like I had to relearn it all too. So I think that's the purpose of making these tribally specific, is that while there are very big differences in climate from tribes in Arizona to tribes in Alaska, there's a lot of similarities in terms of remoteness, ruralness, accessibility that I think can be achieved through these kind of guides.
Can I do one follow-up question with that? Is that okay? If you don't mind.
Sure.
And
go
so
ahead.
yeah, that does make sense. And like I said, you're right. There are issues that paint across the United States, whether you're on a tribe or not. However, maybe in future iterations, it would probably be really helpful to break it into various regions, because as we know, HUD's influence within Indian country looks different based on which tribe you're talking about. For example, some of the portable housing that exists on tribes in North and South Dakota don't necessarily exist within like an Arizona tribe or maybe even an Alaska tribe. I'm thinking in particular with the remnants of the FEMA housing that went to various tribes after Hurricane Katrina that now exist and probably wouldn't fit within the healthy home standard that you're promoting today. So that's one suggestion. And one question then, looking at how Healthy Homes would, your app would be even accessible to, let's say, a tribe that may not have the affordability to have an app. Because digital divide is a real question within tribal nations right now as well, and brought forth during the last pandemic, or during this pandemic actually. So,
and that's a good point. And if it's okay, Brett, I'm going to go ahead and read the next question because it's actually related to that. So the next question was, how do you get the message out to the AI/AN community with getting their homes tested? How do they get accessibility to testing? How to mitigate misinformation? That's a very, very good question. And it's literally sort of the overarching idea behind any guide that we do, including the guides that I presented. One of the things about these specific guides, and there's always a on any guide that we do, whether it's for American Indian communities or not, is the cultural sensitivities. And one of the things that was brought to our attention when we work on this project is that sometimes there is a hesitancy, not necessarily among American Indian community, but other communities, about the trust that they have either with the federal government or with information coming from the non-federal government. And so one of the overarching ideas was to address that this is specifically for American Indian Alaska Natives, even with the diversity and even with the change in region, to get information to say you are important also. You are important enough that we've made a special guide to address your concerns and to try to build up a level of trust that we're addressing concerns in the American Indian Alaska Native community so that they can have be comfortable with the fact that this is not misinformation. This is important information applicable to your community. And we want you to have the trust that what we're telling you is much better than what you're going to get randomly searching on the internet, or information that you would get from, say, another app. Or, there are people out there, as we know, on the internet that are trying to sell you something. And we wanted to make sure that they were aware that this is free. This is important information. It was peer reviewed. It was reviewed by many tribes, specifically so that you could trust that the information is valid and important to you to make your home healthier. So that's sort of an overarching, answer to that question we just got in, but it is related to the sort of the discussion we have about why should there be a separate guide. And this is not necessarily the only guide that is specifically for, we're in the process of working on updating, but we do have, in fact, healthy homes guides for Spanish speaking communities. And that became very important in Puerto Rico when we developed the guides for Puerto Rico. We also have earlier versions of guides in French and Arabic and different languages, because again, we want to make sure that the word gets out that all of this information is important, and we will use whatever vehicle we can to make sure that families get the information they need on this subject, because it is that important.
Can I jump into, just to go back to Brandon's question? I think you put your thumb right on the question that everybody has for everything. It's, how do we make this specific enough to the people that are reading it right now? And we're nearing 600 federally recognized tribes. We know that there are state recognized tribes. We know that there are tribes that aren't recognized yet that will be at some point soon, I'm sure. And how do we make this apply to everyone? And the answer, sorry, I pulled my headphones out because I'm talking with my hands. That's what I do. The answer is that we just have to do the best we can at first, and then just keep narrowing it down from there. And from a HUD perspective, I don't work in ONAP, but obviously the Office of Native American Programs has the longest standing relationship with tribes on housing issues. And these kind of guides, while they may have been developed in partnership with our office, more often than not are going to be distributed and talked about in our regional offices and in the other offices within that region that are going to more specifically know the needs of the tribes in that area. And they'll be able to pull out the pieces and say, this doesn't really apply to you, so just ignore that, or this will apply to you. And then, it's sort of just kind of trickles down. It goes from our regional offices, in theory, to the tribal housing authorities that they work with. And the housing authority can start working with the families when they go in and do the homes. And so the information eventually works its way down, and the people who live there know what they need and they know what they don't. But I don't want to be in a position where I didn't give them enough.
Okay, thank you so much for that lively discussion. I think there's a lot of good ideas there around regional relevance and cultural competency, and I really appreciate that discussion. We are just a touch over our time, so I want to be respectful of everyone, and thank you again so much for spending your time with us, and please join me in thanking our wonderful presenters. I did just put in the chat, and Dree put this in earlier, a survey. It's a quick survey just evaluating this webinar and the speakers. If you could take a quick 3 minutes and fill that out, that would greatly help the National Indian Health Board. I do have just one other reminder. We are excited to highlight the important public health work happening in Indian country during the National Tribal Public Health Summit on May 10th to 12th, 2022. Please consider registering today. The registration link is on NIHB's website, nihb.org. And again, I really appreciate this very fascinating discussion on healthy homes. And as Dree mentioned, we will be sending out a recording and the slides later on this week. And we hope that you're able to join our next webinar in this series on May 25th at 4 p.m. Eastern Time. So thank you all for joining us today. And thank you again to our speakers. Very much appreciate it. And I hope you all have a good rest of your day.
Thank you. Nice to see everyone out.